Today is my surgery day. It's 8:45, July 15th, 2020. For those of you who have been already following me, as you know, I am getting a Brazilian butt lift done, where they're gonna do a lipo 360, take the fat out and put it in my butt and give me a Georgia peach type of booty, you know. So, but I wanted to share with you some of the things that the doctor said and some of the requirements needed before having the surgery. I do know they did tell me that I could not, these are things that have to be stopped 60 to 30 days prior to having your surgery. You know, I smoked for many years, but I had to quit smoking, which I stopped smoking back in April. You can't drink alcohol. You can't wear nails. That's why I haven't had any nails or anything on throughout the journey, because you can't wear acrylic throughout the procedure. I do know some people still wear nails and they might take one finger, one nail off, but I didn't want to take the risk, so I just did what I needed to do, you know, to just to keep myself safe during the process. So I didn't put on any nails at all, but I was able to stop drinking and smoking, so I haven't had a drink or smoked in 30 to 60 days. And today, right before the surgery, they said I could take a shower, but don't put on any deodorant, no perfumes or anything, no makeup, no lotions, none of that stuff. You have to go in there just straight out the shower, but you know, just ready for your procedure. But these are some of the things that that you cannot wear on the day of surgery. You can't have contacts on, no nails. They say don't bring valuables, of course, because you're going to be out of it. No hairpins, no jewelry, no deodorants, lotions, moisturizers, and you must have used antibacterial soap, which is what I brought. I brought like the gold bar of the Dial soap. That's what I brought to shower with, which I use Dial anyway, but this particular brand is the antibacterial kind, is the one that I brought this time. Yesterday, I just kind of wanted to go over some of the details of our consultation. When we did the consultation, the doctor came in. Actually, my heart rate went up, honey. My blood pressure went up because I was so excited. You know, I'm always looking at him on the Instagram videos and seeing him perform his procedures. His name is Dr. Mamiskis. He works at Avana Plastic Surgery over here in Miami, Dora, Florida. I mean, not Miami, but Dora, Florida. So when he came into the room, I was so excited. When they took my blood pressure kind of went up a little bit. Then I also seen Dr. Moranian. Dr. Moranian, he thought I was somebody else. He came out and he was like, "Hey, aren't you so and so and so and so?" And I'm like, "No, that ain't me." But I was like so excited to meet the doctors. These are famous plastic surgeons here in Florida. You know, if you look at them on Instagram, Avana Plastic Surgery, you'll see them. And if you go to Instagram, you'll see all of their work and all the procedures that they do. They do some really, really good work. And I specifically chose Dr. Mamiskis because to me he performs better on black women or women built like me, all bad built and with the big stomach. He know how to break all that down and make you look like a vixen. He's also known as the vixen as well. But at any rate, I just wanted to share that with you guys. When he came into, you know, the consult room, he talked to me, and he was just letting me know that, you know, he's going to be able to get all of this out. He's going to be able to give me the shape and the curves that I want. It's just that I may have a little bit of skin hanging a little bit, but then he would prefer me to do a tummy tuck, but after this procedure is done, because I was going to get a tummy tuck too if he would have gave me a really good deal. But he said to get the best results, it's better to wait until after you do your BBL, because after you get a BBL, you have to lay on your back for the tummy tuck procedure, and you know, you can't lay on your butt or sit on your butt for 6 weeks, you know, so they don't want to jeopardize me losing my fat cells in my butt. So that's the reason why I'm not going to do the tummy tuck on this round. I think that's pretty much it for this morning. Now we have another couple of hours before I head out. So I'm just going to relax, maybe drink some coffee, just kind of prepare myself. Y'all, I could not sleep last night. I've been up off and on all night, just so excited, you know, preparing for this day. And I want you guys to pray for me and wish me luck. And I'll talk to you guys soon. Actually, I'll make another video while I'm at the while I'm at the facility up until my surgery. So I'm trying to take you guys along with me step by step, so you'll see everything that I had to go through. Because I know I watch a lot of videos and they talk a lot, but they don't really show a whole lot. So I decided to take you guys along with me on this journey, because I want you guys to see the process, you know, every step that it took for me to get to this point. And I would definitely record you. Of course, I'm not going to be able to record while I'm in the procedure, but I know they be recording people's bodies and stuff while they're doing the suction, while they're suctioning out the lipo. And I'm going to ask them if they can record mine for me. But if not, hopefully they'll make a video so they can give it to me, so I can add that in there for you guys. I'm trying to give y'all all the details, because that's exactly what I wanted when I was looking at videos. That's why I had to look at a lot of different videos, because they were kind of missing stuff. So that's why I'm taking you guys along with me. But okay, I just wanted to show you all the bed, what I did in order to kind of protect the bedding, the linen and everything on the bed. I had to buy a shower curtain. See this plastic shower curtain? I bought a shower curtain and some bed pads. With these pads, it protects the sheets, you know, because you don't want to, you're going to be dripping heavily with all this fluid and things that's going to be running out of your body. And I don't want to mess up the hotel sheets, because they're going to make me pay for them, and I'm not going to do that. So I just made sure I bought the things that I needed to help protect the bed. I just kind of wanted to give you guys a little preview of what I've done, because we're getting ready to head out, and that I'm not going to have time or the energy when I get back to do so. So, but anyway, and I just wanted to show you guys what I'm wearing. I had to wear one of my granny dresses, because one of my maxi dresses, big comfortable house dresses, because they say you can't wear anything that's tight. You must wear loose clothing, nothing that's fitting or clinging to your body. So I decided to wear this dress here for after surgery. Then you have to have on shoes that you can easily slide in and out, which I thought these were really cute. So I bought these, real comfortable, just something to wear. As you can see, I have taken off all of my jewelry, no earrings, anything. I wore this dress. I know it don't look all that great, but hey, it's gonna do what it's supposed to do. You know that some women, I see them in females in there. If y'all noticed on my last video, they were having robes on and gowns. I just don't see myself walking around in public with, or into any clinic with a robe on and a gown. Now, to each his own. I'm not knocking anybody from doing it, but I just wouldn't do it, you know, because they have dresses and things that you can wear to make yourself presentable when you step out in public, you know. But anyway, this is how I am. I'm ready. I'm prepared. Okay, I am here at the surgery center. I had to come to the restroom because they're making me take a drug test. I think this test, they have to test to make sure you don't have any drugs in your system, nicotine, or make sure you're not pregnant. So I'm about to go back out now. Okay, y'all, I am back. I'm ready to go back. I had to get undressed. And as soon as I didn't sit for very long, not as long as I thought I was going to. I anticipated 2 hours, but they did it under like a little over an hour. I sat outside and waited, and they just called me back. I took the drug test and the nicotine test, and now I'm just sitting here. They told me to come back, and now I've gotten undressed, and I had to put on my compression socks and everything. And now I'm just sitting here waiting to be called back to be put on the table. You guys pray for me. Okay, I am still sitting in this room waiting to be seen, or in the same room where I came to dress down. The anesthesiologist, she came in and she put in my IV. See, she put it in, and just so I can get some sort of fluids, because I am here hungry. Like, I haven't eaten since 6 o'clock yesterday, and it is now 12:30 in the afternoon here, which I got here at 8:45 this morning, and I'm still sitting and waiting. You know, back in Texas, usually if you have a scheduled surgery, you usually don't wait very long. Well, I've never experienced waiting this long. So if you guys are ever planning on coming to Avana plastic surgery center, just be prepared to wait, because I have definitely been waiting. I waited 4 hours and a half yesterday for the pre-op. Now today that I am here for surgery, they ask you to be here 2 hours. Be prepared to wait for 2 hours. But I didn't wait that long in the waiting area. I waited there for like an hour and a half maybe. But I got back here and I'm still waiting. I'm not sure why it's taking so long, but I just hope they can get me back really soon. So.
Something?
Oh my gosh. Y'all, this is so painful. Do I just lay flat down?
Yes.
Oh.
Sorry, babe. A little bigger though. So I'm trying to make you love. I'm sorry. I shouldn't.
Here, I need your signature.
Me?
Yeah.
Please, honey. Please help me.
How do I help you?
This hurts so bad.
Is that?
This hurts so bad.
I know, baby. I'm sorry.
Okay, y'all. I'm in the hotel bed. I didn't know if I was gonna make it. I'm talking about I want a tummy tuck. Shit. This BBL alone was enough. I'm barely hanging on, y'all. But I just wanted to take y'all on this journey with me so y'all can see every step. But now, I'm hurt so bad. I'm like, Lord, please help me. I ain't gonna wanna do this no more. Y'all, I can't make it. Oh, Lord. They put me back on my dress. See, honey, show 'em my thing. Let's raise it up just a little. You can see that big old Georgia peach. Oh, Lord, y'all. I just want to let y'all know I just made it back. I'm alive. The angels and God helped me through it. Praise the Lord. Okay. Y'all have to get up and go to the bathroom. Look at my butt. Put the camera down. Y'all, stuff is everywhere. I tell you. This is a very, very long, hard journey. Now I have to get up. I have to get up and go to the restroom. And my husband just made it back. He had to go to the pharmacy to get my medication. Y'all, I wouldn't wish this on nobody. But now, let me see how I'm gonna get up. Just gotta push up. Okay. Now I'm about to go to the restroom. See, it's my drainage. Stuff is leaking everywhere, I'll tell you. It's bad. So now I have to try and get up out the bed. Oh my gosh, you guys. Y'all should have seen me earlier. I feel a lot better right now because, baby, earlier I was crying like a baby. Y'all gonna see that video if y'all haven't already. Because, honey, it hurts really, really bad. I have to go to the bathroom because it's just too much stuff. Oh, Lord. Let's see. Ooh, the pad fell out. Okay. Yeah, I'm going to the restroom. And do y'all believe I left my urinal? They have a female urinal. I left at home, so now I gotta pee in a cup. Forgot to bring it. Oh, Lord. Y'all see that butt looking all fat? Woohoo! Junk in the trunk. I gotta put these pads right there, y'all, because I'm leaking real bad. Come on, baby. There we go. Okay, y'all. I have to walk every hour for 15 minutes. No matter what. Blood leaking everywhere. You see it's leaking, it's running. It's not, I'm leaking really, really bad. Can you scoot back? Go back a little bit, babe. Okay. So I didn't go out in the hall. I'm just walking around the room. Oh. I gotta walk back and forth. It's hard, but it must be done. Now this is a struggle. Ooh. Okay. Every hour on an hour, they gave me some really strong medicine. Gave me some Percocets, but for me to take once every 6 hours, I just popped one. That's why I'm able to walk around, because honey, I was hurting really bad earlier. So I'm gonna do this for about 15 minutes. Hopefully it'll put me to sleep so I can relax. Y'all, I can't lay on my side. You know, my side is my favorite position to sleep in at night. And I can't even sleep on my side for 6 weeks, because I don't want to mess up my hips. Y'all see that? Yeah, I know this is graphic. If you're not into, if you don't want to see blood, this ain't for y'all. This ain't for y'all. Ooh, y'all got to excuse my room, it's a mess. Ain't nothing I can do right now. My husband is my caregiver. Y'all see that butt? Hey, see that big old butt? That big old kadonka gone? Baby, you ain't gonna be able to tell me nothing, okay? I'm ready. If I could just get past these first few days, I'll be good. All right, y'all. I'm gonna walk about 10 more minutes, because I just started. And I'm gonna get back to you guys later. See you later. Good morning. Today is 1 day post-op from my procedure. I'm feeling a lot better. The medications that they gave me, it really, really helps. And also the walking helped. And plus I've been eating a lot of soup and stuff like that, which helps me get over the nauseous feeling. But this morning I have a 1 day post-op appointment for my massage, so they can go ahead and drain all the fluids off. Yesterday was rough, y'all. I gotta tell you, it was really, really rough for me. But I pulled through thanks to my husband. He was a big help. It's not as bad as it was. I'm not leaking as much, but I'm okay. I'm okay. Now, it's really hard for me to talk, honey. If I tell y'all, I'm just not all the way here right now. But anyway, I just wanted to share with you, like, I know I made a video yesterday. As soon as I made that last video, wondering why it was taking them so long to come, the doctor came in 20 minutes later. He marked me up. Then next thing I knew, they took me back to the operating table, laid me down, put this mask over my nose, shot my IV with something, and it was over. That's all I remember. It was over. I don't remember anything else. And then when I woke up freezing to death. It feels like you're literally in a freezer. I was so cold. And all I remember is waking up and telling the nurse that I was so cold. So she put this warm blanket over me to kind of, like, I think it lets out some sort of hot air. But I was still freezing. I was like shaking and shaking. And then she immediately told me to get up. And I was like, get up how? Like, get up for what? She was like, ma'am, you have to get up and walk. I was like, get up and walk. Y'all know I was so sore. How was I gonna get up? So I got up. I guess they do it every day. So she made me get up off that bed, honey. I got up and walked and got in my wheelchair, and they rolled me outside. And I was like, oh, what happened to recovery? You know, and she was like, ma'am, it's time for you to go home. You know, they get you in and get you out. They ain't playing no games with you. So, of course, I laid in the back of the car. My husband, we were in like a little miniature SUV, so I can lay in the back of the car. And he drove me home. And so, we're back to the hotel. But, y'all, that was my experience. If I tell y'all, it's real, okay? It hurts to be beautiful. When they say that shit, they mean it. Cause honey, I like to die. I thought I was dying yesterday. Cause when the nurse was like, get up, I was like, I can't get up. It was just so funny. But now that I look at it now, it's funny, you know, but it wasn't funny then. Cause honey, as soon as you got done, they was getting you up off that table. But anyway, we're about to head down to the surgery center cause I have to go and get my first massage. And I'll keep you guys posted.
Get in the trunk today again?
Yeah. Okay, you guys, this is what I have to go through to get in the car. I have to lay in the back of the car. See what I have to go through? Oh my gosh. Okay, honey. Okay, y'all. Back at the surgery center, I had to come up here and do my massages. Yeah. Ooh. 227. Let me go ahead and ask about my stuff right quick. Hold on. Okay, you guys, I am back from getting my massage. I was able to take a bath and get all that gooey stuff off of me. As you can see now, they put me on a black faja. I have some pads right here, those Poise maxi pads. They're good for urine. I put them underneath here to prevent the draining from coming out all over. As you can see now, it's, let me show y'all can see. This is much better. Woo, look at that butt. See that? But anyway, I swapped out and just got a new faja. I was able to take a shower. That's what I wanted you guys to see. And now I can go ahead and eat me some lunch. Eat soup, actually. That's what I've been eating. But I just wanted you guys to see how, oh, the massages were so good, y'all. They had to, she rubbed me down really nicely on each of my sides and my stomach to get some of that fluid out because I'm really swollen right now. Because he did a really great job. He got a lot of fat, like 3 liters of fat out of my waist to make my waistline thinner, and then inserted what he could in my butt. So you can't see the results on my waistline just right now because I have to give the swelling enough time to go down. But anyway, I'm feeling great. I was able to shower and you know, freshen up a little bit because honey, it was a bloody mess, as you all could see. But at any rate, I'm gonna go ahead and eat lunch, and then I'll talk to you guys later.